or advancing. But sometimes you did not know. You plan for just a rubber band, put the rubber band, the patient's not wearing the rubber bands. They're asking you, oh, when can I get the braces on? And this is one of the solutions, called the forces. Anybody have used the forces or have heard about the forces? Forces spring? This is a very popular appliances. However, this is expensive appliances as well. So the video, you have to have a band on the molar, class 2, put the braces on, but you have to pre-plan for the band, okay? You have to have a headgear tube and put the appliances. That's a nitite spring. You use an L pin to connect it, and then on the bottom one to put it in directly to the arch wires. And patients, every time patients biting down, that nitite spring will push the lower jaw forward to correct the class 2. Because it's connected to the buccal side, the molar will tip in buccally. So ideally, you want to have a TPA, or you like to have a big rectangular stainless steel wire. There are two different types. One is L-pin, it's a universal. There is no right or left. You can use both sides, but they're called the easy module. There's a right side and left side. Okay? And that's the way, easy module, just push it in and it will click, and then you can connect it to the lower. You don't want to make the overactivation. You want to make it just, you don't ask them to bring the lower jaw forward to edge that. They will end up causing a lot of trouble. So ask them to bite down together with their normal bite, and then you can add a shim later on. For the preparation, you have to use a very thick rectangular stainless steel wire. And then you have to have a tightly cinched back. Otherwise, lower incisor will overly procline, and you're going to see the space open up between here. Tightly figure 8 tie, 6 to 6. And if you don't want the extra lower incisor flaring, you can put lingual crown toe. And how do you know these patients need an overactivation or not? So ask them to bite down together and pushing this spring back. If you see the distance in between is more than 4 millimeters, then you need to add a shim. You have to keep it at least 6 months or 8 months. This is an expensive device. It's more than $200. Why you want to just waste your money? If you want to use it, you want to keep it for a longer time to make sure it works. Let's see this. Look at her face. Look at the overjet. That's a pretty significant overjet. So put the braces on and then the rubber bands, and you see this side is a class 2, full stack class 2. This is very difficult to correct by just a rubber band only. So put the forces, and then this is how she finished. Lots of lower incisor proclination from 93 to 113. 20-degree lower incisor proclination. It's not going to be stable, so you better put fixed retainer for the lower. That's her face. Her face looks much better. That's her bite. So you go ahead and put the braces on, testing the rubber band. Patients is not wearing the rubber band, then don't waste time, just go ahead and put the forces in. 2-year retention. Even with the fixed retainer, you have some relapse over here because we procline the lower incisor more than 20 degrees. Let's see this. He's 12, but he looks much younger than 12. And look at the overjet. Big overjet, low angle, lower incisor somewhat flare. But if you don't want to take the bicuspids out, then you don't have much choice. So put the braces on and then go through the treatment, and then you put the forces, 14.4, 14.7, and 15.11. So we kept it for a long time, and we were able to correct his class 2. That's his face. That's his bite. So that's before and that's after. Let's look at this one. 11, almost 12. Look at the overjet. What are you going to do? You gather up the space on the upper, put the forces, and we kept it, and then become class 1. He had a trauma to the central incisor during the treatment. So that's pretty drastic changes. That's face. I'm almost done, so just bear with me. So let's see the 13 years old. He's class 2. He had a canine infection, about 7-8 millimeter overjet. So they're trying to make the TPA with the circle, trying to bring the canine in, and then put the forces. You keep it. Don't bring the lower jaw forward to make the either overjet and overbite from once. You have to gradually increase activation. Okay? 15.1, 15.2, 15.5, and then we remove it. 10 and 16, we took the braces off, but this side is not class 1. His lower jaw grew, he looks handsome, but we probably should have kept it for a little bit longer. Another patient, 11 years old, really upright the upper incisor. You have to flare the upper incisor. 13.7, and we have some overjet. We tried the rubber band, but this is going to be very difficult to crack the class 2 by rubber bands only. So put the forces and remove it and then finish it. It's still deep, but we improved the class 2. How about the oral hygiene of your Vietnamese patients? Do they brush well, or it only happened in the United States? No? So that's before and after. So this guy. So he's 13, he has a lower right impacted canine, but he has a pretty good size of nose. If I take the bicuspids out, his face is going to look very retrusive. Okay? So he's really a retronative lower. And we align the upper, we make room for the lower canine, and we know we're going to fill the lower incisor. So that's the reason why he had pregingival graft on the lower incisor. So we try to make the room for the canine, which will flare the lower incisor forward. We finally make room. We brought the canine in. He's still class 2. And look at the left side. Full step class 2. we need to move the entire lower forward. It's about 5-6 millimeter forward. If we do that, the lower incisor is going to just fly forward. We asked him for rubber bands, but he's not really wearing it. His lower incisor very flare because we made a room for the canine. And it's not looking good. 4-step class 2. This cusp tip supposed to be over here. So we put the forces. So that amount of changes can happen relatively quickly. If just rely on the rubber bands only, it would probably be difficult. And we flare so much of the lower, I'm kind of worried maybe his root apex will come in from the lingual side up here. Very flare, lower incisor 115. Let's look at this one. She's class 1, right side, only class 2 on the left side. So in this kind of asymmetrical case, normally if you think about it, if the midline is on, if you take the bicuspids out, you can move the canine back, but you end up moving the upper midline too much to the left side. So that's not a good option, just one bicuspid. Maybe you have to take the 3 bicuspids out, or 4 bicuspids out. But why I have to take the class 1 side? So we decide to do non-extraction in this case. Put the braces on, but she's still class 2 on here. We asked her the rubber band, she's not wearing the rubber band. So we end up putting only asymmetrical one side forces, which I don't want to recommend. Do not recommend. Don't do asymmetrical forces. You have to put the other side with almost no activation. That feels much better for the patient. They need to have a spring for the balancing forces. If I'm having only one side active force, patients feel very uncomfortable. Okay? I mean, that's the reason why when you put the class 2 elastic, you always have a balancing force for the triangle elastic, the opposite side. And also, because we put the only asymmetrical forces with this side of the molar intruded, flare buccally. You see the flaring of this side? We finish the treatment, we make the class 1 canine and midline on, but this one is still, this is the side effect from the asymmetrical forces. So basically you want to put both sides. There is another appliance, Power Scope from American Orthodontics. Have you guys seen it before or no? It's not selling in Vietnam. One of our faculty members, he invented this one. You don't need to have a band, you just hook into the wires, but it tends to break a lot, so I don't use it, even though he's a good friend of mine. Well, I will show you a couple of cases. 13 years old, class 2. Go through the treatment. He's not wearing the rubber band, so put the Power Scope on both sides. It acts exactly like the forces. And we correct the class 2. Another patient. This also, go through the treatment, we put the Power Scope, and finish the treatment. Oh, but if you don't have all those things, only things available is a nitide spring. Dynaflex selling 350 grams of nitide spring. Okay, so you can directly hook to the wires. For example, this patient, 14 years old, we go through the treatment. So she's not really wearing the class 2. we put a spring. You can directly hook the spring to the molar hook with the stainless steel ligature tile. So from there, we put the spring on, 1 month, we correct the class 2. Look at the canine. It's only 1 month. If patient's not breaking the spring, 24 hours 7, this spring pushing the lower jaw forward, we correct the class 2. Let's look at this patient. This patient continued to ask for the rubber band. He's not wearing it. So we just put this spring directly through the wire. And on the bottom, you hook to the molar hook, stainless steel ligature tie around it. So this is 17.4, 17.7, 14.8. In just a couple of months, we can make the canine class 1. Another patient, 13. She's class 2. She's not wearing the rubber bands. So we end up putting the spring. This is much cheaper than forces or any other appliances. But it breaks a lot. So you may end up paying a similar amount. 14.7, and then we correct the class 2. So only 3 months from there to overcorrection on the bottom, because the force is hook it, working 24/7. So the most common cause of the extended treatment time is patients not coming, or frequent breakage, or not to wear the rubber band. Those are the 3 things. If you're running your business, you would like to finish patients on time. So non-compliance by not wearing the elastic can be expensive. You will extend the treatment time, you need more appointments, more conversation, more time for your staff, more repair, and you're frustrated, patient potentially can have a decalcification. This is no win-win situation. So if you ask for the rubber band, they're not wearing the rubber band, then maybe you have to charge them. This is how I usually do. Patient's not wearing the rubber band, I don't see any changes. Then say, I'm going to bring these appliances and show them. This is going to be very uncomfortable. And it will charge you extra few $100. Your mom is going to be not happy. Okay? And very uncomfortable. But if I don't see the improvement, I'm going to have to put this one in. I'm threatening them. Some patients, they change, some patients not changing. Then I will charge them, go ahead and put the appliances in, and you finish on time. So you have to think about whether you're going to charge extra or not. That's up to you. You may charge, you increase the fee, and you're not charging extra. Your patient's not wearing the rubber bands, then just go ahead and you have to swallow the fee by yourself. But sometimes you pay extra, you charge extra, patients say, oh, I don't want to do that. Mom said, no way I'm going to pay $300 extra. I already pay you $5,000. I don't want to spend any extra $300. And all of a sudden, patients start to wear the rubber bands. And then class 2 elastic can do some major things. Like, look at these cases. Pretty big overjet. If the patients can wear the rubber band, these types of elastic, these types of overjet can be corrected with no problem. So don't discount the power of the rubber band. If the patient is determined to wear the rubber band, then you can have a nice result. That amount of change is all done by the rubber bands. And this is one of the extreme cases. Patients, a lot of crowding, big overjet. How can you just let patients go and wait until they got all the permanent teeth. I will not do that. And you can put the braces on, and patient's going to have some infection too. So we go ahead and put the appliances, improve his face. He looks much better. And we kept it, and then remove it. So from there to there, it's a big improvement. Then we remove the bicuspid. I guess that now this is remove the bicuspid, and we finish the treatment. So we have a multiple attempts with the fixed functional appliances, forces, did not work, we took the bicuspids out. But we still managed his face is looking decent. From that amount of big overjet to looks totally normal. So let's see this case. So some patient cause a lot of trouble. You may actually pay a lot of money. 11, this is going to be okay, but look at his face. Pretty big overjet. And he's a retronetic. So you put the Mara. He looks a little bit better. But he's still deep bite. That's not totally corrected. You put the rubber band. He's not wearing the rubber band. You end up putting the spring. And then you finish the treatment. So you may need to have a multiple appliances. That's going to cost you a lot of money. So you have to make a decision. Whether should I fix the class 2 from the beginning, and you will fix the class 2 as they don't wear the elastic, fix it later on. You have to have a both strategy. For severe case, maybe just go ahead and do with the fixed functional appliances first. But the conventional, you put the elastic and doesn't work, then we can transition to the fixed corrector. Because the elastic costs you just very small amount of money. All these fancy fixed functional appliances will be very expensive. So the conclusion is, you like to get rid of the uncertainty. Don't waste 6 months. Ask the rubber band, he's not wearing, I'm going to threaten you, I'm going to extract, don't do anything. Then patient will be frustrated, you're going to be mad, mom is going to be mad, patient is not going to like you, you're going to extend the treatment time. So you make the rule. Okay, I don't see the changes in 3 months, I'm going to put the spring in. Or if the patient have a 10, 12 millimeter overjet, it would be very difficult to correct the rubber band. Just go ahead and put the functional appliances in. So for the ultimate outcome, you want to have the multiple tools. So ask, you don't need to have for every single patient, but at least 1 or 2 appliances you want to try first. And then see how they work, just in case you need really big, changes or correction, you can use it. If you haven't tried it, then rubber band is the only option. You will be frustrated. So thank you so much for your attention. Thank you.